Hi, I'm George Mazuragos from Children's Hospital of Pittsburgh and the Starzone Network. Getting ready for your transplant can seem like a daunting challenge. We want to take some of the uncertainty and mystery away from it by letting you know what to expect after your transplant. Children have JP drains, central lines, and sometimes require drainage catheters called PTCs, or percutaneous transhepatic catheters. Our nurse educator, Marci Czachowski, is going to show you what those look like and what to expect.
Hi, I'm Marci Czachowski, the nurse educator at Children's Hospital of Pittsburgh. We're going to be showing you how to do a PTC dressing change and flushing of the catheter. A PTC, or percutaneous transhepatic choleangiogram, is placed after an x-ray of the bile ducts that allow your doctor to determine if bile is passing into the intestine. If the ducts are blocked or underdeveloped, bile accumulates and cannot reach the intestine for the proper digestion of fatty foods. The doctor may temporarily place a PTC drain through the blocked bile duct to drain the biliary fluid. Sometimes this procedure is performed at the same time as a liver biopsy. To change PTC dressing, gather supplies. Dressing change kit and a transparent dressing. Prepare supplies on sterile field by removing from packaging. Some kits may appear different from what we are using. Include 2 ChloraPrep swabs, Mastisol or any sticky adhesive, and skin prep to protect your child's skin. Step 1. Perform hand hygiene. Step 2. Clean area with an antibacterial or antimicrobial wipe to disinfect the surface. Step 3. Place mask on patient, self, second person if present, and anyone within 3 feet of patient during dressing change. Step 4. Open removal pack of dressing kit. Step 5. Perform hand hygiene with hand sanitizer. Step 6. Apply sterile gloves for dressing removal. Place first sterile glove on dominant hand, touching only the outer cuff, non-sterile portion, with your non-dominant hand. Place second sterile glove on non-dominant hand, ensuring to only touch the sterile portion of the glove with your dominant sterile hand. Step 7. Remove dressing from skin using an adhesive remover starting at the catheter lumens or bottom of dressing, then pulling away from the insertion site in an upward motion. Step 8. Remove gloves, perform hand hygiene, and perform sterile dressing change from this point. Step 9. Discard used supplies and remove gloves. Step 10. Open application pack in dressing kit. Step 11. Open and drop new sterile dressing onto sterile field. Make sure not to touch any part of the dressing until you are sterile. Step 12. Perform hand hygiene. Step 13. Put on sterile gloves. Place first sterile glove on dominant hand, touching only the outer cuff or non-sterile portion with your non-dominant hand. Place second sterile glove on non-dominant hand, ensuring to only touch the sterile portion of the glove with your dominant sterile hand. Step 14. Prepare supplies on sterile field by removing from packaging. Some kits may appear different from what we are using. Include 2 ChloraPrep swabs, Mastisol or any sticky adhesive, and skin prep to protect your child's skin. Step 15. Disinfect insertion site, any part of catheter that will be under the dressing, and any area that extend beyond the dressing in a basket weave motion, which is back and forth, up and down. Step 16. Scrub for 30 seconds using friction to disinfect the area. Step 17. Allow to air dry for a minimum of 30 seconds without fanning or blotting. This ensures if any bacteria are present, the skin will be properly disinfected. Step 18. Apply sticky or adhesive in a border outside the insertion site where the dressing will be. Step 19. Position dressing over insertion site using sterile technique as demonstrated. Do not touch adhesive or sticky portion of dressing to gloves. Step 20. Record date and initials directly on dressing. Emptying your PTC drain. Empty the drain at least 2 times a day. Step 1. Wash your hands. Step 2. Remove the rubber cap. Step 3. Pour out the fluid, measure it, and flush it down the toilet. Step 4. Replace the rubber cap. Step 5. Wash your hands. Step 6. Record the amount of fluid and color in your drainage log. If you should have any questions or concerns, please contact your doctor. Flushing your PTC drain. Flush the drain only if instructed by your doctor and amount given to flush the catheter. Step 1. Wash your hands. Step 2. Wipe the stopcock cap with wipes. Step 3. Attach the normal saline solution syringe by turning it in a clockwise motion. Step 4. Turn the stopcock off or away from the patient. Step 5. Flush with 3 to 5 milliliters of sterile saline solution. Step 6. Do not pull back on the syringe after flushing. Step 7. Remove the syringe and discard. Step 8. Wash your hands. Call your doctor if your child has a fever, if your child has abdominal or belly pain that is not helped by Tylenol, for any change in the amount or color of drainage, if your child's drain is leaking at the insertion site or increasing redness around the site, if the drainage tube is out of place or dislodged, any bleeding in the tube or at the site, any new or increasing yellow color on the whites of your child's eyes.